Good afternoon, everyone, and thank you for joining us. My name is Autumn, and I'm one of the co-founders of AVA. I have a couple of fantastic presenters here today. We've got an awesome presentation, Turning Compliance into Consults, and we're waiting for another couple of people to join on. I see a few more jumping on right now, and we will get started. So we have Dr. Jonathan Kaplan here and Chad Sawyer, both of Build My Health. Great presentation coming at you in about 10 seconds. So I will turn it over to Dr. Kaplan. You can read a little bit about them on the screen, and everyone will be getting this presentation after the event. I think we have slides going out as well as we will be recording, so stay tuned for that if you want to watch it again. I'm sure you will. And go ahead, take it away, Dr. Kaplan.
Thanks so much, Autumn. Well, very happy to be here. Both Chad and I are very excited to be here to talk to you. I know that compliance and regulatory issues isn't everybody's favorite. I kind of always dread when I see some email thinking, oh, there's another law I got to comply with. And the thing is, it's a little bit frustrating is that it seems like for the longest time, aesthetics and cash pay really were exempt from a lot of the regulations coming out that were involving, insurance-based providers and things. Like the Affordable Care Act didn't really affect aesthetics that much. But with the recent No Surprises Act and a lot of price transparency rules that have come out in 2021 and 2022, there's a lot more that aesthetics, med spas, IV therapy that we have to really be paying attention to. So we're going to try and make that not so painful. We're going to talk about turning compliance into consults, making this an opportunity, not a burden. You'll hear me say that multiple times. But the thing is that we really want you to listen and understand what applies to you, what doesn't apply to you, specific to the law, and then Chad will then go in and explain how you can incorporate this into your practice, making it as seamless as possible, even getting the patients or the prospective patients to do a little bit of the legwork for you as far as the compliance goes. Chad Sawyer is the Chief Revenue Officer at Build My Health. He's going to be speaking later on in the presentation. And I'm Jonathan Kaplan. I'm a board-certified plastic surgeon based in San Francisco, and also the founder CEO of Build My Health, a price transparency lead generation platform that's also No Surprises Act compliant. So a little bit of background on the No Surprises Act. It was implemented on January 1st of 2022. So it's already the law of the land this year. This isn't something that's coming down the road. It's already here, so we're all non-compliant to some extent. There are a few things that the No Surprises Act, if you break it down into three things, I'm going to gloss over the first two and really focus on the third one. So these are the three overarching goals of the No Surprises Act. Is the idea, of course, is to minimize surprise bills so you don't have surprise bills after getting medical treatment. The first one is minimizing surprise bills in emergency situations. So that's not really the audience today, so I don't want to spend any time on that. The second part of the No Surprises Act is minimizing surprise bills for out-of-network care that you have to get consent from somebody to agree to get balance billed, to get out-of-network care. That's not really today's audience either. So we're going to just jump right into the third part of the No Surprises Act, which is a federal law that applies really to everyone, regardless of whether you're in aesthetics or not, and I'll get into why that is. But the idea behind the No Surprises Act, minimizing surprise bills when people are not using insurance, that's the third part that we're going to focus on in my part of the presentation. So how do you minimize surprise bills in that situation? Well, you give people an estimate ahead of time to minimize the bills that they're still going to get bills after the fact. You just want to minimize the surprise bills after the fact. So according to the federal law, the good faith estimates must be given to patients that are uninsured, so they don't have insurance, so they need to know how much they're going to potentially owe ahead of time. That's how you minimize surprise bills after the fact. The other is choosing people who are choosing not to use insurance, or they are self-pay. Now, what that means is somebody has insurance, but their deductible is really high. They need an MRI, but if they just pay cash for the MRI, maybe it's $350 as opposed to having to meet a deductible that's $1,000, and then they're going to get this much more expensive insurance bill. So that's why somebody would choose to not use insurance and just self-pay. Now, in all this federal billing requirements, as far as the No Surprises Act, the regulations that were implemented by the Center for Medicare and Medicaid Services, CMS for short, NSA, by the way, the abbreviation is No Surprises Act. All those regulations, the law never mentions aesthetics, never mentions cosmetics. So you're thinking, oh, great, we're scot-free. We don't have to worry about this. Well, the problem is they use the term self-pay throughout the regulations about the good faith estimate. And any of you that have any knowledge of insurance know that self-pay is not really the same as paying yourself like you would if you're a cosmetic patient. Because a cosmetic patient, it's not that they're choosing not to use their insurance. They don't have the option of using their insurance. It's cosmetic. It's categorically excluded from their insurance policy. So the thing is, self-pay, even though the way I like to compare it to the analogy is ride sharing is not the same as sharing a ride with somebody. Those are two very different things. There's sharing a ride with somebody versus ride share is obviously Uber, Lyft, things like that. Well, according to the regulations, they're saying that self-pay, which is really only dealing with when people are choosing not to use their insurance, they're saying that's the same thing as paying yourself, i.e. cosmetic, i.e. aesthetics. So even though I don't think they intended for aesthetics to be included, it's included. It's been swept up into it. And the thing is that CMS, Center for Medicare and Medicaid Services, they've issued several clarifications about the Good Faith Estimate, the No Surprises Act. And in all of those clarifications, they've had the opportunity to say this doesn't apply to aesthetics. They've never taken that opportunity to say that. So as of right now, this does include aesthetics. Now, how does it include aesthetics? Do you have to give a good faith estimate to every person that comes in who just wants Botox? No. So this is how I'll break it down onto who this applies to. So it either applies to situations where the patient is going to have to be paying multiple providers, or if they're having to pay for multiple sessions. What do I mean by that? So in the first example, multiple providers. So if you're a plastic surgeon like me, you're going to your in-office operating room, or you're going to a surgery center, the patient's going to be having to pay your fee, the facility fee, the anesthesiologist fee. There's going to be other reasonably expected costs like labs, implants, potentially post-op garments, things like that. So if you have multiple providers involved in the mix, then you have to provide the patient with a good faith estimate. So we have to provide a good faith estimate to all of our surgical patients. And we'll show you an example of what a good faith estimate looks like. Now, the second part that that applies more to our audience today, whether it's med spas, IV therapy, that involves people that are dealing with patients that are dealing with multiple sessions ahead of time. So again, if somebody's just coming in for Botox, no. And I'm extrapolating this from the regulations that talk about people going in for lab work. If you're just going in for one-stop lab work, the patient doesn't have to get a good faith estimate. So if they're going in for Botox or filler, they don't need a good faith estimate. But if they're going in for multiple sessions of physical therapy, multiple sessions of family counseling, or multiple sessions of like a membership or a package of laser hair removal or IV therapy packages or Botox filler packages, those kinds of things where you know ahead of time that there's going to be multiple sessions, you have to give the patient a good faith estimate in those situations also. So this is what a good faith estimate looks like. And I didn't just make this up. The Center for Medicare and Medicaid Services, CMS, they gave a very clear template of what these good faith estimates have to include. Now, this is the one that our system in our office that we use, we generate this automatically. It's really, really easy to do because we don't have to think about every little thing that we have to include for each good faith estimate. It's automatically produced. And so at the top, it has to have the patient's name, has to have their address, it has to have an internal ID number. It also has to have their phone number, their date of birth. I mean, these are the things that CMS is requiring that you have included. So the other things are it has to have your tax ID number. I don't know why. It has to have your provider NPI number. So be it. That's what CMS says the good faith estimate has to include. And it has to have a diagnosis code. So even though these are aesthetic things, there's a diagnosis code for that. So you have to include that diagnosis code. And then this is an example of a good faith estimate, not so much for the surgical because that's not really our audience today, but if this was a surgical good faith estimate, it would have my fee, a breakdown of the OR fees, the anesthesia fee, post-op garments, cosmetic insurance, implants, things like that. It would include all of those fees. You can't just give them like one number. It's like, it's $10,000. You have to break it all down. And then in this case, this example, we're talking about an IV package that we offer in our office. And the IV package is, they get it for 6 months and they pay a certain amount per month. And we explain all that, what is included in the package. It's going to be very explicit in the description, as you can see on here. And then not only does it show the patient what their monthly fee is going to be for that package, but it also shows them what their annual cost is going to be. In this case, their annual cost is annualized because it's only 6 months. But the point being is that you have to show them not only their monthly cost, but what their annual cost is going to be. And this is something that's got to be done according to the No Surprises Act, CMS regulations as they stand right now, because they do include all of us. So this is something that you should be doing right now. If you're not doing it in an automated way, it's a little bit more frustrating, but Chad's going to go into how you can do that in a more automated way so you can view these regulations. We want you to at least view these regulations as an opportunity, not a burden. So before I hand it over to Chad, again, I just want you to keep in mind, this is all about compliance with the No Surprises Act. How do we do that? How do we incorporate that into our daily routine to make it as smooth and seamless as possible so that we don't make mistakes? Because if you do make a mistake, it is a $10,000 penalty from the federal government for people who either violate any part of the No Surprises Act, whether it's the part where you're billing people after the fact for an emergency situation when you weren't supposed to, or if the other ones that may not necessarily apply to you. But if you're also not providing good faith estimates when you should be, then you are liable for a potentially $10,000 penalty. So Chad, take it away.
All right. Well, thank you, Dr. Kaplan. It's always a treat getting to listen to you talk. I know how passionate you are about the No Surprise Act. I really don't know if I haven't met anyone, and I've done a lot of speaking, guys, and gone to a lot of events that is up to date like Dr. Kaplan is. So when he talks about these things, it's important that we hear them. And I know when we talk about compliance, our brain starts to go a million ways, and a lot of times there can be some fear associated with that. But when we step back and kind of think about it, the question we have to ask ourselves is not whether or not we have to comply. Unfortunately, we all have to comply, but it's then, okay, once I understand what it takes to be compliant, what can we do to turn that in a way that it can help our practice grow? So the theme that we want to talk about today is turning compliance into consultations, so that when we check that first box and we know that we are in compliance, what are the three other things that every single practice business in the world wants to do? We want to improve the quality and quantity of traffic to our phones to get more high quality opportunities. We want to increase revenue. We want to increase the retention of patients that are coming into our office. And then we also want to decrease some of those unnecessary marketing costs. One of the things that I'll talk about is looking through it. And because before we go into how can we automate some of the communication that Dr. Kaplan's talked about to make sure, there's a set of things that we need to make sure that we're doing. So for practices on here who have been around for a while, who are doing some of these things, I want you to look at this list and ask yourself, okay, am I doing all this? At what level am I doing it? And then do we have the proper reporting analytics provided to us where we can make a value-driven decision based on what's working? And then for new practices, people who are looking at the space, or if they're in the middle of their build out, wherever you're at, as you start to think about how you're going to attract patients, these are things that you really want to be focused on. So the first one is, do we have a mobile responsive website? Do we have a site that is updated with our top frequently asked questions for our best treatments and procedures? And what I mean by that is, what is it? How does it work? Am I a good candidate? So that when a patient searches online, and if you have your updated before and after galleries, which are really more before and after galleries, I guess, are going to be for the practices on here who are doing some type of surgical or non-surgical treatments, but it comes with IV hydration and IV therapy, patient testimonials, reviews, talking about those benefits. Do you have someone in your office who is spending time creating content for search engine optimization? Are you doing it? Are you working with someone around you? So a company that is helping you create content so that when someone types in, I live in the Boston, Massachusetts area. When someone types in IV hydration, Boston, Massachusetts, or the surrounding areas, or the questions, am I a good candidate for IV therapy? What is IV therapy? How do I do it? That you're going to start showing up over time so that you can get those opportunities. If you're newer in your practice, or if you're not getting the desired number of patients that you want today, probably the fastest way that you can tomorrow go out and look to increase quality and quantity of traffic to your site is going to be through paid advertisement. I'd look at doing things on Google ads, social media advertisement. Great ways are Facebook, Instagram ads. Make sure that you create a strategy when it comes to the paid advertisement. The way that differs from organic is going to be, organic is you're earning your way. Paid advertisement, whatever Google sets that cost per click, that's what you're going to have to pay. But it doesn't mean if you don't have strong calls to action on your site that you can't make the most of those opportunities. Some examples of calls to action that I definitely want you guys to look at your site and go to and check is, do you have an ability for a patient to schedule online? Now, not every patient is going to schedule online. Even if you have someone who, they find you, they read about it, they read about the before and afters, they decide that this is really going to help bring value to their life, they still might not be ready to make that next step to getting on your calendar. So do you have a form where they can leave their name, their phone number, a verified email address, a treatment of interest? Do you have a phone call prominently displayed? All of these things need to go in place so that if you're going to go out and spend money or spend time, resources to get opportunities to your site, they need to have the opportunity to get engaged with. So that brings us to, does your website make you money? Because it should. And if it doesn't, what are the things that you can put in process to do that? So what I mean by that is, let's say you check all those boxes that I just talked about, and you actually get what I would refer to as a miracle in marketing, as someone now finds you. And I say miracle because there's so many factors in place that you're putting in a lot of time, but it doesn't always result in getting the opportunities. Well, what can you do on your website to start to engage with patients? You don't want to always leave it up to the patient to call you, to schedule online. You want to start engaging with them right away. And if you're going to tell them all the great benefits and treatments to IV hydration, what's the next thing that is going to probably come to their mind? That sounds good. What does it cost? And that's when we start looking at incorporating some of the things that Dr. Kaplan talked about. So we know that if we look at the way that the world is changing and patients are being granted more access, more rights to getting that pricing information, that's where we want to start to look at how we can incorporate that into our marketing. And now when someone comes on our site, let's put some type of chatbot on there or some type of way where they can click, get a quote, get access. So they go in, they build out their treatment plans. We exchange name, phone number, email, and then automate that process. And now the other thing that you need is you need some type of dashboard and that can be in your EMR, that can be in a CRM or a customer relationship management tool if you're not familiar with that. You need some type of third-party dashboard that as patients start to come through, and now you've put in the hard work to engage, you're not necessarily putting that on the staff to where they have to stress about it. You can automate a lot of this and check the box for that compliance piece that says, hey, if someone's going to come in and look to do IV and they're going to come in and hopefully do a number of different treatments with us or come in a number of different times over the course of their patient lifetime, let's get something for that and start to build our marketing database so that even in the sad cases when we do all that and they don't schedule right away, we can still build out that database so that we don't always have to go out and spend more money to get more opportunities. We can make the most of what's being presented in front of us. So that's one thing that I would definitely look to incorporate into a site is some type of engagement tool where we can automate that communication. Your staff or your front desk or yourself first, if you're a sole provider, doesn't have to worry about every single person that's looking to get some information. You can automate that. And then the big thing that I really want everyone to start thinking about if they aren't is elective medicine, specifically IV hydration, IV therapy. That is a retail business. And why I say it's a retail business is the holidays are coming up. Every single one of us, including myself, is going to do some type of online shopping. Does your site, if you go on there right now, does your site operate in a way that's conducive to starting a buying process? Meaning if I go on Amazon and I want to look to buy something for my family for Christmas, I'm going to be able to add items to my wish list. Well, does your site allow for patients who go on, they read about the treatments, they say, yeah, that's amazing, I want to do that. Can I click around and click on IV therapy, look at my options? Can I click on multiple? Can I apply filters so that even if I'm not ready to have a conversation with someone inside of the practice, I know I think I want to do this. Let's give them the opportunity to where they can build out their cart. They can add in, and you should be adding in when you have something like this, add in before and afters, spend time creating marketing videos talking about the treatments, put that right in there so that they can add these items to their wish list. And then when they submit wish list, going back to what Dr. Kaplan was saying, because you have to do it, we can automate that good faith estimate out to them, breaking down all the potential costs of their treatments so that they can decide, okay, yeah, I think I want to do this. And now your staff, on the other hand, needs to be getting notified that you have a new opportunity so that you can reach out to either have a phone call conversation where you're adding more value, trying to get them scheduled, or automating some type of email or text communication so that you're moving them through the process. But by doing this and setting up your website to actually allow for patients to go through and start building out their desired wish list, you're not spending time away from the front desk, or in even some cases, maybe the front desk person is not the most equipped to handle all of these conversations, and occasionally we can be talking about high dollar value treatments. The ability to automate that process and build the value with patients is going to save you a ton of time. It's going to build a tremendous amount of value and just move people through the process, and also kick out some of the people, because the reality is, guys, not every single person has enough money to come in. So if we can move those people off right at the beginning, you're going to be able to increase those conversion rates in terms of the amount of people that you're talking to that's going to schedule consultation and then move through to the buying process. So, and this is just another example of what a good faith estimate is. Definitely, so you're going to check the box from a compliance by putting something in place like this. All that information that Dr. Kaplan talked about, right? Needing their name, their address, email, tax ID, NP, everything. Automate that ahead of time so that you don't have to worry about it. Your staff or yourself doesn't have to go in and build out every single one of these. And then what you should be doing is, as you engage with people and as you create these estimates, you need to have a database like I talked about, so you can see all the people who come through. And what you'll be able to do over time is, I don't need to tell you what a potential treatment is going to be worth to your practice. Whatever that treatment is, you should know, okay, yeah, if we do everything right, this is what this is probably going to cost. So if we have 100 people at $1,000 an opportunity, we can now look at data that tells us we have $100,000 in potential revenue, get to a place in life where if we see that number, okay, we usually convert 50 to 60% of our opportunities into patients in the next 2-3 weeks, whatever that number is. It's not necessarily the point, but project out what the actual revenue is going to come in from the opportunity revenue, so that you can talk with your staff or with your marketing people or whoever and make data-driven decisions and automate a lot of that. So the other thing, and it's a big, something that I'm a huge fan of, especially when it comes to the IV therapy world, is memberships and packages. So, and I know I can't see you guys, but who in here is doing memberships or packages? And I know you have to have software, either your EMR or other softwares out there that can actually build out the memberships. So let's assume you check that box and you have something in place that you're not being prevented from doing this because of a technological reason. It's more just you haven't really thought about it. Well, here are some of the benefits to memberships and packages. You're going to get recurring revenue coming in on a monthly basis, no matter who comes to your site. You're going to increase the lifetime value on a per patient basis. This increases the retention of people that are coming in. And then if you get people on memberships or packages, it's going to increase the amount of times that they're actually coming into your office, which is going to give you and your staff the opportunity to cross-sell other products and services. So if you have treatments that go great with IV therapy, if you have skincare products or any type of retail component that you want to sell to your patients, you're giving yourself that many more chances to get in front of them. But then also, you need to make it easy for your patients to buy, right? You want someone to be able to go to your site who maybe they've come in and seen you on a one-off basis before, and now they're scrolling through your website and they're just reading about different things. Do you have a component in place right now where they can actually click on a package or a membership program, understand the description, and check out right on your site? Because there are ways for you guys to do that. And now your staff doesn't even have to have the conversations to tell them, oh yeah, this is what's in our package, what's in our membership. They can buy right on your site, you collect that, and now you have a patient that's going to be coming in, whatever the set time is based on the treatment or the package that you can. And then the other thing is having some type of email automation. So in addition to what you're having when someone reaches out and wants to become a patient and they get that initial information, what are you guys doing to the point when you have that conversation with that person who they say, you know what, it's a lot of money, I have things coming up, I can't make a decision right now, I still need to talk to my husband or my wife, and now they didn't say no, but they might not be ready to come in. Are you going to be able to have something in place where you're automating on a monthly basis so that 6 months from now when that person decides, you know what, whatever I was dealing with has only gotten worse, they've been receiving email communication, text communication from your office, and now you don't have to go out and consistently reach out to more and more people. You can focus on the database that you've already built, you've engaged with, and you can market to them, which is going to only help you guys do more. So with all that being said, let's say you incorporate some different things. You want to make your website more lively. You want it to engage with more people. Now we need to separate the facts versus the feelings. And here are some questions that you should be asking yourself. And if you know the answers to, that's great. If you don't know the answer to, I would encourage you to go back and look. Do you know if your website is making you money? Do you know how many unique visitors got your website this month? Do you know how many of those visitors contacted the practice? Do you know how many of those people came in for a consultation? Do you know how much time was spent working on those opportunities? Do you know how much time or money you spent to generate those new opportunities? Do you know what the ROI from your marketing efforts are? And then most importantly, do you care and should you care? When it comes to your website, guys, I refer to the websites as your virtual medical office. That needs to be a place where it's the first interaction that someone's going to have with your business. It needs to be something that's contributing to the revenue coming in. And if it's not, then I would consider looking at that. In some of the data, and these are just some examples of reporting dashboards that you should be able, if you don't have something like this, you should get something similar in your practice. And the data that I'd be looking at, what is my cost per lead? What's my estimates? How many unique opportunities are we generating? What's our cost per lead? What's the opportunity revenue versus the actual revenue? What's the breakdown, so that if we see, hey, we've been doing all this for the last year, we thought we were getting a lot of new patients from our social campaigns, but in reality, we're growing word of mouth. What can we do to diversify some of those new opportunities? You need to make sure that you're tracking that data so that you have access to that information to make those decisions and be able to understand, hey, when it comes to some of the stuff with the No Surprises Act and what Dr. Kaplan was talking about, if we're starting to push out that information around pricing and trading, pricing for valid contact information, let's figure out, do we know what the discrepancy between our original and our final quotes are? What's the discrepancy when final quotes are higher versus when the quotes are lower? What's the percentage of consults that are booking when we're giving them a higher price range versus a lower price range? All things that are going to show you and be able to give yourself the opportunity to not just look at how your marketing and your website's performing, but how are you and your staff performing to know, okay, when we get someone into our practice, how are we closing those opportunities? How are we extracting the revenue? And then looking at what our retention rates are. So those are all the things that I'd want to look at. Being able to track, I think, is super important. You can probably do this in your EMR. There's other third-party softwares out there. If you're collecting all those new opportunities that, again, you're spending money and time to generate, do you understand where all those opportunities sit? Do you know what potential treatments they're interested in? Do you know if their quote has been generated? Do you know if they've been booked? So that you can start to see the performance of your staff, of your website, and track what those closing rates are. So just to kind of summarize everything when it comes to the No Surprises Act, patients' research reviews, before and after photos, we want them to check pricing online, capture contact info. You should be looking at ways for patients to be able to auto get synced up to your email database so you can follow up with them so you don't have to take valuable time away from your staff. You want different touch points to go out every single time that you do an email marketing campaign or a text message marketing campaign. Create that No Surprises compliant quote so you check all your boxes. You're never at risk, which at the end of the day is really the most important thing. And then ultimately, let's get them to book the service or the procedure and get them to come into the practice. So with that being said, I'm going to check down in the questions and see if we have anything, but that's kind of everything that I have for you guys today. So just give me a sec. We'll see if some of the questions pop in.
We do have some questions, but also want to remind everybody that on the panel on the right-hand side of your screen, that control panel towards the bottom of your panel, there's a place for you to enter questions. No question is too silly. It can be about running your practice. It can be about the No Surprises Act. But please submit some questions there. One question was, what do you do with all the leads or the email addresses that you get when people are checking pricing through a chat bot or the price estimator on your website? Obviously, one of the main things you want to follow up with every single patient if they provide you with their phone number. The patient, at least with our price estimator in our practice, we're able to toggle it whether we ask for the phone number or not, or whether the patient's required to enter that information. We also have a thing with Google single sign-on where that makes it easier for the consumer to sign in and create an account to submit a wish list, because they don't see a price until they provide us with their contact information. But when they go through Google single sign-on, we only get their email address. So in those cases, we don't have a phone number to call back. But if we do get a phone number, we call the patient, follow up with them, see if they want to come in. And specifically to the email addresses, those are just automatically being funneled into our email marketing database, which That's like things like an email marketing database is like Constant Contact, MailChimp, MyEmma, Campaign Monitor. So all those things are automatically being filtered into our email database. And then from there, we are sending out newsletters. Used to be I would send out a once a month newsletter, but then we found that it was actually more engaging and better to send out once per week newsletter. And sometimes we send out 2 a week. You just have to make sure you're always providing good content in your newsletters. We don't ever really have anything that's like, oh, we've got actually we specifically had a Black Friday non-special. Basically, we told them that we don't have specific specials for Black Friday. We have specials all year round in the form of memberships and packages. So you definitely want to be sending out email newsletters, staying in touch with those people. But again, you've built this huge email marketing database. Like Chad said, that's the least expensive marketing you can do, is sending out newsletters to your existing database, because it's always easier to keep patients than it is to find new, and certainly less expensive than getting new patients. But with the email newsletters, with the emails that we capture, we send out newsletters once a week, twice a week, always with good, fresh content. We switch between surgical subject lines to IV therapy to injectables, always trying to keep it sort of fresh and keep it interesting. But the email database that's my favorite thing about all this marketing, is that you feel like you're getting something for every single patient that's showing up on your website, because you can't follow a click. You can have 1 million people coming onto your website, clicking all over the place. Can't follow a click. So you have to give them as many good calls to action to leave their contact information as possible, whether that's a contact submission form, which I'm not a huge fan of because you have to manually reply to them. But then there's also the chat bots, the price estimators. Those things are great for capturing contact information, and it gives the patient that immediate gratification of getting pricing information, because that's what they want. They don't want to put in a request for pricing information and then get this automated email that says, oh, we'll get back to you with an estimate. That's irritating as hell. That this is nice that they can put in their contact information and then immediately get an automated email with a breakdown of their pricing, and of course you get the contact information in response.
Yeah, that it looks like we have another question, and it's I guess it's kind of a comment. It looks like they want to know some of the concerns with putting their pricing online, and what I and Dr. Kaplan, I think, would both be in agreement here is, when you talk about using the No Surprises Act to your advantage when it comes to marketing and exchanging pricing for contact information, I think it's important to remember that we're not encouraging, or no one's necessarily encouraging you to put on your website, on your services page, what your cost for treatments are. But what I think is important is, if you're going to spend the time and the money building out a beautiful site, writing all of that content that's going to tell someone what the benefits are, the logical next step for that person is going to be wanting to get access to pricing information if they're going to do what ultimately we all want them to do, which is to move to the next step and become a patient and transact with us in the practice. So we don't just want to give out pricing for nothing. We're getting something for that, but we're also encouraging people to, one, you have to do it, but then two, using that as a way where you don't have to take away that time from the staff. And if it is just someone who's price shopping, who has no money, never can transact with you and do any type of services with you, then that's good too, because now you're not taking away any of that time to get the answer that you could have got with just one simple question. So we want to make sure that you're checking all the boxes, but not just doing things. And then the other side of that is, if you're someone who's concerned about weeding out price shoppers because you're not a low end solution, let's say you think that you're the highest cost for treatments in your area. Well, how do you know that? And I'm not saying that you aren't. What I'm saying is, are you figuring out are you going in some type of database, putting in your costs, understanding what your treatments are, and looking at, on a national, regional, local scale, the comparison of how your rates actually stack up to others? Because if you're going to put yourself in a position where you and your staff are creating content and talking about being a high-end provider in your area, then make sure that your pricing reflects that. Or on the other side, if you want to be a high volume, low cost solution, the last thing you want to be doing is saying, hey, we're the lowest cost, and then they realize they can go shop around at 5, 6 other places and get costs that are significantly lower than yours. So just make sure that You are understanding how your practice stacks up. Try to find ways. Dr. Kaplan and I both know a couple different places that you can actually go in and find out how you stack up in terms of a price comparison. And then on the other side of that, remember, pricing and that information is not something that you want to shy away from. If anything, it should be something that's going to add value and help increase the amount of opportunities that are going to translate into patients in your practice. So I would not be concerned about automating some of that pricing information. I know, Dr. Kaplan, in your practice, you guys probably.
Yeah, that's a great clarification. Yeah, we're definitely not saying just list your prices as a menu, because you're like giving the milk away for free. You're not getting anything in return.
Right.
And so by using a chatbot or a price estimator of that nature, where the patient has to put in their contact information first, that's I feel like is a good compromise. You're giving the patient the pricing information they want immediately, as I've mentioned before, but you're getting something in return. Plus, a menu doesn't really, it's a little bit too limiting, because if they want to do combinations of things, combination treatments, laser hair removal, IV therapy, you might have a package deal that makes it less expensive. So if you just have a menu of prices, then they're going to add this to that and think that's the total. Whereas if you have like a price estimator or more opportunities to make that easy for them to shop through that menu, then they can see those combination procedures and get the correct price that may be a discounted combination procedure. And obviously purchasing those things too it's a little easy. You can't really do that through just a menu. No, that's a great clarification. And then yes, as far as comparing pricing, that's what everybody wants to know is, what are my competitors doing? And one of the things is, because we have such a huge database of people, of providers' prices, when we log in and you look at the dashboard and you see, okay, this is what I'm charging, you're able to see anonymized comparisons. This is for the provider. This is not the consumer. This is not like an Amazon for the consumer where they just say, oh, let me just go to the cheapest place. Definitely not that. But for the provider on your dashboard, you can see how your prices compare across the U.S., region, state, 50-mile radius, and zip code. You can see basically, okay, like I'm charging this much for IV therapy. What's everybody else charging for that particular type of IV therapy? Or I'm now offering the weight loss medication semaglutide, which is the generic of Ozempic and Wegovy. What are most people charging for their weight management programs and for the medications for that? So it's really nice to be able to see how your prices compare. It was something you really couldn't do before, other than being a secret shopper and calling around to different practices, which if that annoys you when people do that to your practice, then you probably shouldn't do it to other practices. And there's easier ways to do it now. Anyway, that was the last question. What if there are any other questions, this is your last opportunity before we sign off. But if you have any questions for us that you don't want to enter into the question frame, then you can obviously email us at the email addresses on the screen. You can learn more about the No Surprises Act at nosurprisesact.com. You can learn more about how to get certified, to make sure you're checking all the boxes. But if there anything else you want to add, Chad?
No, I think guys, I guess one thing would be, thanks to everyone who came on, stayed on. Compliance, as Dr. Kaplan and I know, it's not always the sexiest topic, but I think if we're, and you guys know this as you're looking to either come in the space or you've been in space, the opportunity here when it comes to IV therapy is huge. But that also means that there's going to be a lot of competition. So I'd encourage you guys, just go out and try to find different ways to separate yourself. And one of the most underrated ways to do that is through compliance, and promote on your website. If you're going to go out and spend time to understand about the No Surprises Act, and if you're going to make sure that you're in compliance, promote that, market that, let patients know. Because what will happen is those people who maybe they are checking out 3-4 different practices or competitors to do this with, they'll realize, because they're smart people, they'll realize that, hey, what's this No Surprises Act certified? I didn't see the other 3 people in this area that do it. It looks like these guys have an awesome website and they're in compliant. They're putting their patients first. Maybe that's the person that I want to give my business to first. So when we're looking in elective medicine, anything that we can do to stand above the competition is going to help us get those couple extra patients that are going to make a huge difference. And I think compliance is a great way to do that. In addition to some of the other things, having a strong social presence, a strong site, good quality content before and afters, those things that I mentioned. But compliance will take you a long way. I think it's something to look into.
Thanks so much, Chad. Thanks to Autumn and also to the American IV Association. Thanks to Gina, Jeff Cohen. We appreciate y'all inviting us on. We appreciate everybody joining us today, as Chad said. And again, if you have any questions, email us and we'll be happy to answer any of those questions. We look forward to seeing y'all next time. Take care, everybody.
Have a great day.